Welcome, Greek U Nation, to episode number 533 of the Fraternity Foodie Podcast. I'm your host, Mike Ayalon, CEO of Greek University. I'm a speaker and an author. Our sixth book just came out. It's called I'm So Beautiful, It's Ridiculous, Unleashing and Promoting Strength, Self-Worth, and Real Sisterhood. So I want you to go and pick up that book on Amazon or Barnes & Noble today. We call these episodes the Fraternity Foodie Podcast because there is nothing like great food to bring college students together. Fun fact, I played basketball in 7th and 8th grade at Solomon Schechter Hebrew Day School. And the guys on my team had full-grown beards and fully developed muscles in 7th grade. I have no idea what they were feeding these guys. I was the smallest guy on the team by a mile. While I didn't get much playing time, I was very thankful that they would let me come into the games when it was a blowout and we needed to rest our starters. They still cheered for me with every basket, but I realized back then that I would never have the height to be a good basketball player, and I needed to find some other sports that my body was a little bit better suited for. So, speaking of basketball, we have a great next guest for you, Dr. Michael Milobsky. He is the owner and operator of Pediatrics at the Meadows. It's a primary care pediatric practice in Castle Rock, Colorado, and he is committed to keeping patients healthy and safe by providing unparalleled access to excellent in-office care. He is a renowned, trusted, and skilled diagnostician with 20 years of experience as a pediatric hospitalist and pediatric emergency physician. He's dedicated to diagnosing patients quickly and accurately and following up with the most appropriate, effective, and up-to-date treatments. He's also the owner of Chicken Soup Pediatric in-home urgent care and Concierge Healthcare. He also has additional training in managing and treating chronic pain and addiction in adolescents. Welcome to the show, Dr. Milobsky.
Hey, hi, Michael. Thank you for having me.
Hey, it is a pleasure to have you on the show. Thank you so much for being here today. I'm so grateful that Dr. Louis Profeta introduced us all the way from Israel. So that is a fantastic connection that we share. And I wanted to talk a little bit about your undergraduate experience because you went to a fantastic, top-notch school called UPenn for your undergraduate experience. And I'm sure that you could have attended many different institutions. There's no question that that is a correct statement. And all of them, I'm sure, are great schools. But I need to know, why did you choose UPenn?
So it's a long journey. My journey to Penn was not linear or straightforward. My journey to Penn started when I was 9 years old. I was, like a lot of undersized and sheltered Jewish kids in the suburbs, obsessed with basketball. And, right around 9, 10 years old, basketball was kind of my whole reason for being. I lived it, I breathed it. The JCC Boys League was the height of my entire year. And I remember 1979 was the first collegiate Final Four I ever watched on television. And for those I'm sure no one in your audience is going to remember this, but 1979 was the year that Magic Johnson at Michigan State and Larry Bird at Indiana State faced off in the national championship. But to get there, Magic Johnson had to face in the Final Four the mighty Quakers of the University of Pennsylvania of the Ivy League. And I remember watching that game. It was the first tournament game I ever watched. And just listening to when my parents talked, watching the game, listening to all the hype around Penn. And there was something about that said, that's what I wanted to do. I wanted to play there. I wanted that experience. I wanted to be part of that, whatever that was, even though at 9, I probably couldn't articulate it very well. My journey through that process, if any of your listeners are college athletes at any level, will be familiar, an enormous amount of focus and time and effort and overcoming my own physical limitations. Not, once again, a Jewish dentist kid from the suburb isn't exactly what you think of as the prime Division I basketball sort of candidate, but I sort of forced my way through the process with sheer, intensity and focus. However, I was also a late bloomer, and none of these schools were interested in me by the time I was leaving high school. And the only places that were Division III schools. So I actually went to Tufts my freshman year. Some of your, in Medford, Massachusetts, some of you guys may be familiar. And I had a great year there. I enjoyed it. I made great, still in touch with the coach, still in touch with my freshman year friends, but it wasn't living what I was intending to do. It was a failure. All of us have setbacks. I considered it a failure. But that summer, I also tried out for the United States Maccabi team. For those who don't know, the Maccabi games occur in Israel every 4 years. It's an Olympiad-style Jewish event that brings together Jewish athletes from pretty much every country that's free. And it occurs, in 1989 was the 13th Maccabi Games, and I was fortunate enough to try out and be selected to the United States basketball team. And through that experience and my teammates, a couple of them went to Penn. That was my pathway ultimately to getting into Penn and attending and becoming a player there the following year. So, transferring was not an easy thing in 1989, 1990. There was no portal. You had to sit out a year. It was a big difference in the way it is now. But once again, all of that to me was secondary to the fact that showing up, playing in the Palestra in West Philadelphia and the Philadelphia Big Five and playing at Penn to me was the whole thing. And it didn't matter what I needed or what I had to sort of go through to get there. And that's how I ended up there.
I love that story. That's incredible. I saw some old clips on YouTube of you dunking the basketball, which was very cool.
Yeah, I know, right? VHS tapes. It's all rotting. There's no digital video back then. So someone managed to save a rotting VHS tape in the back of a closet at Penn and put it on the internet. So yeah, there's one 17-second snippet that is the only evidence that I existed in Division I college basketball.
I love it. I love it. But I mean, I'm sure that had a major impact on your life playing basketball. Can you talk about how playing basketball just impacts your life and your career?
Yeah, it's really interesting. That's a great question because as we had talked about before the show, I'm deeply involved in adolescent and young adult mental health, and I reflect back on my own experience as a college athlete, and my experience as a college athlete was, I'm not going to say it was fun. It was wrought with an enormous amount of negativity and setbacks and difficulties and expectations not being met, and despite my best efforts and despite giving it my all, still having failures and still not living up to what in my head I had imagined it to be. I had probably, I haven't done the actual math, but I might have the least statistically significant career in the history of Division I basketball. I'm not sure, but there are probably not many guys that have less of a statistical impact on college basketball than I did. But to me, I was able, because of the time and place in the world we lived in and the lack of distractions, and I found value in my very presence and persistence, and that is what elevated me, regardless of whether I got attention or adulation or glory or always was a starter or always was living up to what I thought I should be doing and on the team and otherwise. So learning that type of mindset and resilience and tolerance for failure and tolerance for understanding that success and process is a long-term game of persistence, even if it doesn't feel good and doesn't feel like it's ideal at the time, really set me up for everything I did later, going accepted to medical school, becoming a physician, becoming a parent. I have 7 children. I have 3 grandchildren, raised a big family. So that experience for sure had infinite value for all of those things.
You went to the University of Maryland for med school. I know there's a lot of our listeners that are thinking about med school. My daughter is certainly thinking about it over at Rice. I hear there's a good medical system right across the street from Rice in Houston.
Pretty good one.
Pretty good. So,
pretty big.
What was medical school like, and what's your advice for other college students that are thinking about taking that route?
My oldest child is currently a med student, and so I recently walked this path with him. Obviously, things are very different now for the process than it was in the late 80s, early 90s. Back then, If you simply decided that you wanted to attend med school and your numbers lined up, you pretty much assured of getting in somewhere. It really wasn't much of a question. And nowadays, that is not the case. What they are asking undergraduate students to become and to do and to engage in, beyond just excellent grades in the sciences, which I know how much work that takes, to me is mind blowing. And watching my son go through it, you're basically being asked to become a dedicated researcher and a full-time volunteer and all of these things in addition to everything else in order to even be considered. And even then, I know many kids, including my contemporaries of my sons, who did everything right and still don't get in and have to reapply. So the path, I'm not going to minimize how different it is for today's undergrad who wants to be a doctor. And that being said, having been in medicine now for 25 years and in this current era of medicine, there are a lot easier ways to make money. So in my opinion, the only people who should be doing this should be doing it not for, anyone who is hoping for a certain amount of prestige or hoping for a certain amount of financial gain. None of those things really exist in the same way anymore. But it really needs to be the type of calling, the type of situation where you can't imagine waking up every morning and doing anything else. And that's why you do it.
Got it. Well, that's definitely good advice and something I think the undergraduate students listening really have to think about in today's journey for med school. Yeah, one of the presentations you mentioned mental health. One of your presentations for college students is called Mind Matters: Essential Habits for Thriving in College and Beyond. And in there, you talk about this critical link between mental health and academic success. Talk to our audience. What is the link between those two?
So in my experience as someone who takes care of young adults, adolescents and young adults and college age students with mental health and kids who have really struggled with their college experience, what I have seen is that a lot of kids, and I know that you talk about this a lot in the things that when you were addressing and writing about college experience, so many kids show up on campus having worked extremely hard to get where they are and seeing this as kind of the manifestation of what they have been working towards and dreaming about and their family dreaming about for a very long time. But their expectations are wholly not in line with what the realities of living away and living on a college campus are likely to bring them. And when they show up and they have a hard time adjusting to the differences between their expectations and the realities, not to mention for a lot of these kids, this is their first experience with failure. High school, I'm sure, I know how hard everybody works, but college can be the first time where they experience something where they were hit with the thing they didn't expect. They weren't successful, have to regroup and experience failure and a setback for some of these people the very first time.
Mm.
And then add to that the social complexity of a college campus and all of the demands on your time and being confronted with situations, ideas, and relationships and things that you have never really been involved in or prepared for. And that can lead to being completely overwhelmed, having nothing to do with whether or not you are smart enough or have the tools to get good grades or not. And a lot of the kids that I see that end up having to leave and not really fulfilling their dreams and their promise when they get to college is not because they don't have the cognitive intellectual tools. It's not because they're not smart enough. It's because they had no idea how to navigate this complex set of situations when they got there vis-a-vis what they were expecting and then what the realities were. So in order to be successful, you have to be emotionally aware, emotionally healthy. You have to know how to take care of yourself. You have to understand what your limits are and how to manage your strengths, and then how to understand what your weak areas of weakness are and how to manage those, and how to keep yourself in an emotionally balanced, healthy place. Mental health, as you and I both know, is not being happy all the time. That's not the definition of mental health. The definition of mental health, especially on campus, is understanding your feelings and that they make sense to you and that you have healthy coping skills in order to navigate and manage them. And therefore, if you can't do that, it doesn't matter how smart you are, and it doesn't matter how you're not going to be successful.
Very
on a
good. Very
college
well said.
campus.
Yeah, I like that a lot. The other thing that I think about too is a lot of our audience, they're all in fraternities and sororities for the most part. So they're living in close proximity with the other students. How can these students recognize the signs of mental distress in their fraternity brothers or sorority sisters?
I think that a lot of young people, when I talk about this, it'll feel like common sense. I think what prevents them from helping or taking action is fear of getting involved, fear of overstepping their bounds, fear of maybe being rejected or called out because they decided to speak up and say something. But in general, if one of your peers and one of your colleagues, one of your friends, one of your um, friends in your sorority or fraternity are having a significant change in how they show up every day. They are isolating themselves. They're sleeping all the time. They are showing emotional changes and feeling overwhelmed at every step. Those are the first outward signs to someone else that your friend may be struggling and that your friend may be in a place where they're having trouble righting themselves and having trouble managing what's going on. And there's nothing wrong with in a genuine curious way asking how someone is doing and asking if they need help. Most campuses, I know you know this, have resources on campus. A lot of kids are afraid or don't feel that they need to ask because they've never faced this set of conditions before. So they don't even know sometimes how much difficulty they're having. They don't recognize it themselves, but someone else will recognize it.
So maybe we can role play this a little bit. Let's assume for a moment that we're fraternity brothers. I'm in my room and I don't leave for 7 days. And I'm also not taking a shower for some reason. And all of this
Yes,
is
yes,
completely out of the norm for me, right?
yeah.
So, how in the world are you going to persuade me, another student, to get help?
I think the best way is one that you knowing that you have the kind of relationship with this person, that you're a person in their life that can show up and ask a question.
Mhm.
Obviously, friendships are different, but understanding your relationship with this person is a good way of gauging how it's going to be received. And two, the most effective way isn't to show up and go, you're doing this and you're doing this and something is wrong. The best thing to do is go with curiosity and with affection for this person who's your friend, holding up a mirror and saying, hey, look, I just want you to know what I'm seeing. Here's what I'm seeing.
Hmm.
And when I see this, it looks different than the way I know you. And so that makes me concerned about how you're doing. Stop. And for a lot of kids, when they take that approach, it's way easier to bring the person that you're trying to help forward into the conversation. Because if you show up with, hey, we're having an intervention now, that tends to push people away, make people defensive. So showing up with curiosity, showing up in a sense of asking questions and just reflecting your experience and pointing out how it's just different than the way I know you, that can often bring kids into the conversation that allow them to take the next step to get help.
That's a great strategy. I like that a lot. You mentioned coping skills earlier. I think a lot of college students today don't necessarily have those fully developed coping skills yet. So they end up a lot of time in my experience, they end up abusing alcohol. It could be drugs,
Yeah.
etc. So what is the impact of substance use on mental health?
So here in Colorado, our experience in our college campuses and high schools has been the massive rise in widespread cannabis
Right.
use in marijuana because we were one of the first to legalize.
Hmm.
And so what we see here, alcohol is not a new problem on college campuses. Alcohol was an issue in the 80s. It was an issue in the 90s. Kids all of a sudden released from the supervision of their household and showing up in social situations that are free are experimenting with drinking and the dangers of that. And Dr. Profeta talks about that in an amazing way. I love his talk. For the students have had a chance to hear him. What I have, the biggest change in substance vis-a-vis mental health has been cannabis. And the reason why is that in a lot of states, cannabis is becoming easier to obtain than alcohol. And two, there's a lot of misinformation and disinformation about how cannabis impacts our brains and our emotional development. And the people who sell the cannabis and the people who market the cannabis would like you to think that it's uniformly safe and uniformly natural and has no downsides. And the science simply is different, and that people go to college with emotional brain development and frontal lobe development that is still not complete. In fact, most of your students, most of the people that listen to this podcast and that come talk to me do know this. Your brain wiring isn't really fully complete until age 25. So you add to that a substance that has an enormous impact on how you feel. Cannabis is a really popular way to cope with, hey, I'm feeling anxious, I'm feeling stressed, I'm feeling really uncomfortable with my situation. And when I use this, I immediately feel better. It's way different than alcohol in that sense. It is highly medicinal, at least in people's experience, for alleviating really negative feelings that are coming up with that they're having trouble managing. The problem is that when you are introducing that substance, especially at the potency that we see it now in the 21st century, you are hijacking the healthy, normal wiring and interaction between your emotional brain and your frontal thinking, rational, frontal cortex brain. And it makes it harder and harder to manage and develop healthy ways to manage your anxiety and or your depression and your emotions. And so you keep going back to adding more and more cannabis to do that for you. And it becomes a vicious cycle. And contrary to a lot of what people learn about cannabis, it is highly addictive, especially in the strength and potency that is commonly available now, that is, once again, very different. So that is where I see the newest, biggest challenge for students on campus with substance abuse and mental health is cannabis. Obviously, the alcohol thing is not new and continues to be a problem, how people manage their relationship with alcohol when they are, free on a college campus without the same kind of limits that they had in high school.
Yeah, that's a great answer. And thank you for, really giving the scientific reasons on why it's a problem. I would love for students to just delay the use of cannabis until their brain is fully formed. If you want to start at 30. I'd rather have that.
It's
You know
not the
what I
same
mean?
problem in someone who's 30 as it is in someone who's
I
18,
know.
19, 20. It's
But the
different.
problem is the students see that the state has legalized it in the state of
Yes. So
Colorado.
it seems, hey, so why shouldn't we?
So
Why
why
shouldn't
shouldn't
we?
we? That's exactly the
Exactly.
argument that I get from students when I talk about alcohol and drug abuse prevention. I'm sure Dr. Profeta gets the same thing. If it's so bad, then why did the state of
And
Colorado
why
legalize
is it
it?
legal? Right.
Right.
Exactly.
And so it's hard to have that discussion, especially with an 18 or a 19-year-old.
And
Very
especially
difficult.
when they're getting information that completely contradicts what the science and reality is, because they're getting that information from the people that want them to buy the cannabis.
Yeah, well, that's very true. All right, so let's put cannabis aside that,
Yeah.
we both agree that it's problematic to
Yeah.
use that when you're 18 or 19 or 20 and your frontal lobe is still developing. So what are some other coping skills, maybe mindfulness techniques that students can use when they feel stressed out?
So I think the mindfulness gets thrown around a lot, and it's a tough word because I think it means a lot of different things to different people. So when I'm talking about mindfulness, I'm not people often think about the incense and the candle and lotus position, and that's not really what we're talking about. We're talking about recognizing the impact of all the parts of your life and what you do and your habits and routines on how you feel and your ability to manage setbacks, difficulties, and your emotions. So, so a big part of that on college campus is recognizing how your emotions are not necessarily your reality. When you feel threatened, when you feel anxious, when you feel upset because you were introduced to an idea you don't like, this person voted for Trump, how could they, that those things don't have to be your reality. They're just feelings that you're having, and that it's okay to simply not allow them to. A person can, with practice, choose, and this is a lifelong practice, it's still difficult for me, to choose to not make their emotions their reality. It's just something that they're experiencing in the time, and they can choose to simply disengage from it and move on. So, and not get sucked into these situations, which can become so powerful on college campuses because you feel you're aligning with a cause or something you believe in, or you so hate what this stands for and you want to let people know. But inevitably, that for a lot of kids, that's just the risk benefit ratio, and how that helps you be the most successful you can be for you isn't always there. And two, recognizing that when you get to college, you are lacking the same structure and supervision and things that most kids had at home. I'm going to go out on a limb and saying the vast majority of these kids did not spend 2 months at sleepaway camp a lot of time. I don't know if you did, but I certainly did because it was that time.
Yep.
Jewish people did that.
Yes.
So this is their really first time that they're away from home for an extended period of time and that they're responsible for themselves and not recognizing that prioritizing the quality and type of sleep that you get, prioritizing your physical well-being with exercise and nutrition, prioritizing your mental well-being by saying, hey, these things are important, and understanding how to prioritize things. People think that they did that in high school because, well, I was chairing this and I was president of that, but it's not the same. And learning that you can say no and learning that it's okay to remove yourself from things because you have these other 2 or 3 things that were like what we talked about before that really supersede everything else. And you don't need to extend yourself and give your time to everything just because someone asks you. Those are the types of mindfulness that I try to get kids, because it's practical, it's actionable, it's understandable, much more than lotus positions and incense and, visualizing your breath, which doesn't resonate with a lot of college students. Not that it can't, but,
Yeah, it's
not
interesting how
practical.
things change as you get older. I think
Yes.
when I was younger and when I was in college, I felt a very, very strong need to be well liked. Like that for me was very, very important. But then as I got older, now I realize that all that's really important is my family and what my contributions are. How can I save as many lives as possible, right? But like some of those other things just kind of fall off. And so your priorities change as you get older. So I think that's certainly part of it.
But I think that's a great point, Michael. So many kids, because everybody there is new.
Yeah,
Everyone there shows up with no social group established.
right.
So everybody wants to be well liked. And so you tend to put other things aside just because you want to be well liked. And that can sometimes be a real hindrance to your mental health.
100%. That's 100% and really important to talk about, I think, with today's youth. And
Yeah.
one other piece that I wanted to talk about that's kind of related, we talked about saying no. You can say no to things when you're overcommitted, but I'm just telling you straight, the college students that I work with, they are completely stressed out all the time. They're not sleeping enough. They're not eating right. I mean, it's just a complete mess. And a lot of it is just time management skills that they really
Yes.
don't have. They're overcommitted in terms of school, in terms of their student organizations that they're involved with, like
Yeah.
fraternities and sororities. Many of them have part-time jobs. They have internships that they're trying to get. They've got relationships, with a significant other on campus. So how do you manage all of this from a time management standpoint?
So I think that one is the important thing is going back and being honest with yourself about what really serves you and what is really all the things on that list that are serving your ultimate goals and things you want to achieve when you're in college. And you're to your point, that's really hard to do for a lot of kids when you're 18, you're new on campus, or 19, you want to be liked, and so it seems to you that all these things really do, but in fact that they're not. They're simply just fragmenting your ability to take care of yourself. So that is a really important skill to get down first year, is how to make those decisions and how to take action on those decisions. Second is, as the Navy SEALs are fond of saying, that you don't start by looking at your whole day and your whole task. You start by breaking that up into small pieces and then getting through one and then thinking about and going to the next. Navy SEAL training is a lot more transparent than it used to be because of all the television shows, things that we can watch now. And, despite what you may think or how you feel about the military or whether you think that applies to you or not, because I couldn't imagine living through or enduring what they endure, but the lessons are real. And so that is how their mindset, how they get themselves through days that seemingly have this impossible mountain to climb. And if you think about it all at once, and that's to relate to it, you have a hard time even engaging it. You just want to turn around and walk away from it and quit, or not even try. And that's one of the things that they learn in that incredibly stressful time of their training is you have to not look at the giant hill. And let's say all of it is stuff that has to get done. It's not, there's lots of, it's not optional, but you have to be able in your head to go, look, I'm just going to focus on A, B, and C right now. And then once I get to A, B, and C, then I'm going to go to the next thing and then the next thing. And then that's how mentally we can all approach these things in a healthier, more productive way without getting overwhelmed and our system being, our emotions kicking in and then hijacking the process.
Nice. All right. Very good. That's actually really helpful. So thank you. Thank you for sharing all that. Now, I was born in Mount Sinai Hospital in New York City. And in Mount Sinai Hospital in that area, I mean, there's a lot of kosher restaurants that I go to. I mean,
Just
it's
one or
just,
two.
just one or two. I mean, you could throw a rock and you could
Yeah.
hit a million kosher restaurants in New York City. And they're all, one is better than the other. But you're living out in the Denver area. So if I'm out there and I want a really good kosher restaurant to go to, I can't imagine that there's so many out there. It's probably a much smaller number. So where do you go for a good kosher meal out in Denver?
I'm going to say, where do I go for a kosher meal
Yeah.
in Denver? Mostly we cook. We've been living here for 25 years.
Yeah.
For most of that 25 years, there's been a single restaurant to go to.
Okay.
That's the East Side Kosher Deli. Now, it's changed hands a couple of times. There's definitely some better things to order and some less better things to order, but the menu has not appreciably changed in 25 years. And so it's very basic stuff. You can get a sandwich, you get a hamburger. It's certainly not a foodie's dream. And it's like a lot of kosher restaurants that are out here in the Jewish diaspora of America, if you want to say it that way, are overpriced and not so good. I'm going to my son who lives in Chicago has literally 30 different kosher restaurants, each one better than the next,
Right.
gourmet level. We
Mhm.
don't have that. So in the last couple of years, we've added, in my humble opinion, an excellent pizza shop, like rivals New York in terms
Wow.
of pizza. And it's not just my opinion. New Yorkers have told me they've come out here, they've eaten it. So the kosher pizza there, Brooklyn pizza is pretty good. And there's a new Israeli restaurant called Asli, which serves basically shawarma and schnitzel sandwiches and platters. And it's, once again, it's there. If you just get sick of cooking at home, you can eat it honestly. But it is not, you don't move to Denver if you're Jewish because of the food. You move here because it's a beautiful place to live. It's a beautiful community. Your kids, all my kids are like black diamond skiers, thank God. And it's great weather. And there's a lot of beautiful things about living here, but it's not like living in the tri-state area from a food standpoint. That's for
Right.
sure.
Yeah, Chicago has some really, really good kosher
Really good
restaurants.
ones.
Very, very good. But hey, listen, the pizza shop, that sounds just fine to me. I
That's
mean, I can
fine,
go and
right?
check that out. Yeah, I could
Yeah,
always go for a good slice. And I really
yeah,
do miss
exactly.
New York pizza. I mean, I really miss it. So if you got a
Yeah.
good Brooklyn pizza out there, I will
Yeah,
definitely,
yeah, come out. We can do that and
yeah,
go to
we'll
the
do that.
hill.
We'll meet at Brooklyn Pizza. Does that sound all right?
Exactly. Absolutely.
All right. So if our student listeners, if they want to connect with you for speaking opportunities, where should they
Sure.
go to connect with you?
So my first is simply my email. It's my first initial and last name, Milobsky, MMILOBSKY at Gmail. Also my Instagram, Dr. Michael Milobsky, and Peds at the Meadows. Pediatrics at the Meadows is the name of my practice. Both have Instagram pages, and DM me through there. Also, my TikTok, Dr. Mike M, has a very big audience, and so they can also direct message me through any of my social media TikTok accounts, and also both of those Instagram have linked Facebook accounts, which I know none of your students use. Facebook is dead to them. I don't even know why I said it. That was a
Dead
mistake.
to them. Dead to them.
Dead to them. So scratch that. But those are the best places to find me and reach out to me.
Dr. Mike M on TikTok. Go and check him out on TikTok. He's got a big following over there, so very impressive, I have to
I got
say.
some street cred. I got some street cred with my daughters on TikTok.
You have street cred, just like I have street cred with my kids on TikTok. And I'm
A
like,
little
who's
bit.
got more followers,
A
kids?
little bit. Exactly.
So that's always fun. But hey, listen, Dr. Michael Milobsky, thank you so much for spending time with us today. This has been great information. So
Yeah,
we
it's a
appreciate what
pleasure.
you do. Thank you.
Thank you, Michael. I appreciate it. And congratulations again on your dissertation.
Yes, thank you so much. You're actually my first guest since successfully defending my dissertation. So from now on, it's Dr. Mike.
Dr. Michael Isle. Yes.
But yeah, very happy to have defended and happy to make that contribution in terms of hazing prevention research. So I appreciate that. Thank you so much. And to
Thank you
our
for having me.
audience, thank you so much for listening. We hope you had a good time, and we hope to see you on the next episode of the Fraternity Foodie Podcast. Thank you so much, and bye for now.